Red light therapy, or RLT, has become a groundbreaking non-invasive method for improving vision health and addressing retinal disorders. Utilizing specific wavelengths of light, it targets cellular repair and reduces damage in conditions like age-related macular degeneration, glaucoma, and diabetic retinopathy. Let's explore RLT's mechanisms, effects on the retina, clinical applications, and its future potential. The retina, a vital structure in the eye, consists of photoreceptors that process light into electrical signals. It is supported by the retinal pigment epithelium, which manages metabolic waste and ensures oxygen supply. Mitochondria, abundant in retinal cells, fulfill the high energy demands required for vision. RLT operates within the 620 to 700 nanometer range for red light and 800 plus nanometer for near-infrared light, offering tissue penetration tailored to specific eye structures. Red light primarily targets photoreceptors and the RPE, while NIR light reaches deeper layers like ganglion cells and the optic nerve. RLT's effectiveness stems from its cellular impacts. It stimulates cytochrome C oxidase in mitochondria, enhancing ATP production essential for cell repair and energy-intensive processes. Studies, such as one published in 2020, demonstrate improved mitochondrial membrane potential and photoreceptor regeneration with 670 nanometer wavelengths. Additionally, RLT modulates reactive oxygen species, reducing oxidative stress while maintaining their signaling roles, thereby preventing apoptosis. Research highlights this effect in AMD models, showcasing improved photoreceptor survival. The therapy also enhances circulation through nitric oxide production, promoting vasodilation and improving retinal blood flow. This reduces hypoxia-induced damage and stabilizes capillaries, preventing complications like macular edema. For instance, a 2018 study on diabetic retinopathy observed better retinal perfusion and waste removal after RLT. Anti-inflammatory properties are another cornerstone of red light therapy. It reduces pro-inflammatory cytokines such as TNF-alpha and IL-6, which are elevated in chronic retinal conditions. Clinical trials reveal decreased inflammation in AMD patients following 12 weeks of therapy, correlating with improved visual function. Additionally, red light therapy regulates retinal microglia, fostering a repair-friendly environment. Beyond inflammation, red light therapy boosts collagen production, supporting retinal structure integrity, and enhances cellular longevity by reducing mitochondrial stress. Patients with early AMD have reported reduced macular drusen, likely due to improved metabolic clearance in the RPE. Comparing red light with near-infrared light highlights their distinct advantages and limitations. Red light effectively targets photoreceptors and the RPE, making it ideal for retinal photoreceptor repair in AMD. Near-infrared light, with deeper penetration, benefits ganglion cells and optic nerves in conditions like glaucoma. However, near-infrared light requires strict controls due to potential risks like overheating and oxidative stress. Clinical applications involve carefully designed protocols. Effective wavelengths for retinal therapy range from 630 to 670 nanometers for red light and 810 to 850 nanometers for near-infrared light. Treatment durations vary from 2 to 10 minutes per session with daily or bi-weekly schedules. Safety measures, including protective goggles, ensure minimal risks. Studies validate red light therapy's efficacy. A study done in 2020 reported a 17% improvement in color contrast sensitivity in older adults using 670 nanometer light. Research also demonstrates reduced oxidative stress, inflammation, and drusen size in age-related macular degeneration patients, while models of retinitis pigmentosa show preserved photoreceptor structure and reduced apoptosis. Despite its promise, red light therapy faces challenges. Near-infrared light poses risks due to its deeper tissue interactions and lack of natural eye filtering. Optimizing protocols for wavelength intensity, duration, and frequency is essential to balance safety and efficacy. In conclusion, red light therapy offers a revolutionary approach to vision health, combining mitochondrial stimulation, anti-inflammatory effects, and enhanced vascular function. While red light remains the gold standard for retinal disorders, near-infrared light holds potential for deeper tissue repair, albeit with caution. Continued research will refine these therapies, illuminating new possibilities for treating retinal and optic nerve conditions. At Makari Wellness Neurovision Acupuncture Specialists Clinic, we specialize in treating all varieties of eye conditions by addressing the internal imbalances of the body to foster natural healing and regeneration. Ready to see the world more clearly and improve your overall health? Contact us today to learn more about how we can help you achieve lasting results. Visit us in San Diego or Oceanside, California, and explore more on our website at macarywellness.com. Your vision is precious. Let's work together to protect and restore it.